So good afternoon again, everybody, and we'll start with introducing our two speakers. Dr. Jeyakumar, maybe you can just tell us one sentence, a minute about yourself, Kumar.
Hi, I'm a Wallace retired doctor and a still active politician.
Okay, and Cecilia?
I'm just somebody who is very passionate about elder care, specifically in the world of dementia.
Okay, first of all, I would just like to ask Cecilia about the state of elder care in Malaysia. How many elder care homes are there in Malaysia, and roughly are they private or public? And just tell us what you know about the state of elder care in Malaysia.
Yeah, thanks, Anil. But maybe I do a little bit of detour because I've been in this industry for the past 20 years in elder care. And I have been in discussion about such as this in conferences and in seminar. And this phenomena is called the population aging. And Malaysia have got we're wearing a new hat. We are an aging nation. And I think we need to zoom out first. I will answer the question, but I think we need to look at things in a bigger perspective and not miss the whole picture of how did we get here and what is it all about in the whole picture. About a century ago, in 1900, I would not be here. Most of you will not be here because we will not be alive. The life expectancy of a newborn baby, 1900, was about 30 years old. And now fast forward, our life expectancy is almost doubled it. For a man who is 20 years old in 1900, it is quite difficult to have his mother who is alive. And today, a 20-year-old man can expect to have a living grandmother. And that's a really great achievement to see now that today, in today's world, we can see 4 generations, even 5, coexisting in the same period of time. And this has never happened before in a human history. And I think that's something that we ought to celebrate, that it's a great achievement as a human culture to have what we have today, because of so many transition, revelation, improvement that we as human beings have evolved so much and we have achieved so much. And it's amazing that that is something to be celebrated because here we are alive, And I was alive. I could see my grandmother. My son was there to see his great-grandmother. When my grandmother passed away, there were 4 or 5 generations celebrating her life. And we miss all that. But we are looking at the negative side of aging. It's so gloomy. We look at the newspaper, we are so worried about the statistics, about the burden of care. And we are being swayed into looking at such a negative side of aging, and actually looking at the whole population, those who are in an institution like a nursing home, is less than 5% of the aging population are in an institution, right? Of course, it is now on the increase. We get to see even new terms that used to be very unheard of in Malaysia, like retirement villages, wellness, very center. It's very up-notch kind of settings. In Penang, we already have 3 so-called retirement resorts, retirement villages, and all that. And it's fast becoming popular and being introduced to Malaysia. But that was not our norm. How did this happen? How did we begin to then segregate the old and the young, putting the old away in institution? Or we can have a very high class resort-like, but the idea is segregation, And I think we need to look at that in a broader perspective. So now in a nursing home or these facilities, we have 1,700 establishments throughout Malaysia. And based on that, those who are registered with license are about 360, 370. Most of them are private sectors. We do have some who are on welfare basis, and
What's the percentage of a public-private, do you think, roughly?
it's very low. So I don't have it in government. You have the Rumah Sri Kenangan that is run by the government. That's 17, and Rumah Sri Kenangan is for those who are able-bodied. You know, those who are not bedridden, who are still can walk when they admit them. And Rumah Ehsan is for those who are bedridden, okay? And we are only 2 in Malaysia, right? We don't really have the proportion of totally NGO run, because usually there's a mix. Some of them who have got residents who are not able to pay the full amount, they're able then to get assistance from the welfare home. So it's really a mix, and not all of them are fully charitable, unless there are some run by the church or the Buddhist association, pretty negligible.
What the ones run by the government, what's your impression of the condition of these homes?
So I must have a disclaimer first, Anil. This is purely my own personal opinion and my own personal perspective. I'm not representing anybody. I'm not representing any groups or NGOs. This is purely Cecilia Chan, okay? So that's my disclaimer. I think if we remember history, once upon a time, couple or maybe 10 years, 15 years ago, I can't remember. And there was an issue. Somebody went undercover, and I think there was a reporter from Star or Straits Times, I can't remember. And she went undercover to one of the RSK, Rumah Sri Kenangan, and reviewed the dire situation of the day-to-day living life experiences of the people, the residents in Rumah Sri Kenangan. And there was an uproar about it. And there were discussions and debates about it. And about a few months later, we forgot all about it, and we're back to square one. So that's my answer.
Kumar, just want to check with you. Cecilia mentioned that the minority only are in the care homes. From your experience in communities, how are people, especially in the lower income group, coping with caring for elders?
Yeah, Anil, thanks. I think it's quite tough, for people in the lower income category, already struggling to look after their own children and their own expenses. It's actually quite tough because a large number, maybe about 75, 80% of people above 70 have no financial means at all. They've used up whatever savings they had. So that makes it very, very difficult for people in the B40 who themselves are struggling to make ends meet to look after. So it's actually quite a big struggle. I think old age poverty is a really big issue, and it's going to become bigger as we go along. So like Cecilia said, our life expectancy at birth is now about 76, 78 years. But that's at birth, When you come to people at the age of 65, people who have survived that far, they're going to last into their 80s on the average. So it's another 20 years of life still, And once they're above 70, most of them don't have savings. Unless a very small number, maybe about a third of them will have financial means. 2/3 do not have. And those who do not have tend to come from the poorer families. So it's actually quite a difficult situation because, you lose your dignity, when your children kind of quarrel who should look after you now, or when one of your children's spouses say something, the hurt goes deep. So a lot of them have to put up a lot of indignities because of this lack of funds.
Yeah, and also we know that after the COVID pandemic, during the lockdowns and all that, there were a lot of people allowed to withdraw their EPFs, EPF savings. So a lot of them have also depleted their savings. What's the situation now? Can you brief us on that?
Yeah, sure. Do you mind just put on the slide for me? Slide number 3, you can go into that. That actually addresses that question. Basically, this slide is statistics given by YB Stephen Sim in Parliament in response to a question by Dr. Zul. And basically, if you look at the slide, go to the third one, please. It's number 1. Go down to third one. Yeah, that one. Right, it's the one. So they looked, the question was how many people age 54, how many EPF contributors are there age 54, and what are their savings like? And you can see that 81% of them had savings less than 200,000. EPF has said your minimum that you need when you're 55 should be about 240,000. So you get $1,000 a month the rest of your life. But this is, only 20% of them, 19% of them had that. So the majority of people do not have enough EPF savings, and if you go to the slide before this, the first slide, this is 3, it's the number 2. Just go to number 2 for a moment. One slide before. Now, this basically shows the number of people in the workforce. Yeah, that one. We have 16.4 million in the labor force, and there are only 8.3 people actually contributing to EPF actively now. And then another 1.4 million are government servants. That leaves another 6.7 million who are contract workers, smallholders, fishermen, small businessmen, roadside stores and all that, gig workers. So quite a number of people don't have EPF at all. So even those with EPF, only about a fifth of them will have, the 240,000, the minimum to look up to them. 80% of them do not have it. And then you have a lot of people who don't even have EPF. In addition to this, you have another about 3-4 million people who never enter the labor market. You have 3-4 million people who, housewives, people who have got disabled, who never enter the labor market. So you can imagine, EPF isn't really covering the majority. Even those it covers is not sufficient cover. So it's quite a dire situation. And that is why we have been proposing a universal pension scheme for all those who need it. More or less for 80% of the population now, proposing a pension scheme.
Yeah, we will come back to that later. Cecilia, that's the problem among the lower income group are facing. But even among the middle class and even the upper middle class, private retirement homes are also not cheap. How much are we talking about?
Yeah, so now there is a huge range of the cost is pretty big, the range. Now, actually, I was invited. Again, I'm this disclaimer, I'm talking for me. I was invited by one of the developers during the pandemic to join a scheme to be a consultant of a sort of a retirement resort in KL. And I'm not going to disclose the name of the resort. And, we were talking about the facilities and the infrastructure, and I was trying to convince them to include dementia care. And he was telling me, just a matter of factly, these are really for the upmarket, and it costs about 20,000 a month. And the 20,000 a month is not inclusive of care, it's not inclusive of food, it's not inclusive of whatever expenses, it's just for staying there for the facilities. They have the clubhouses and whatsoever. So that's the kind of amount that we are talking about, in a resort. And the lower market that we have, in Penang, I would say is about 2K. So that is the scenario. And we are talking about this is the basic cost, so it is, if you need extra care, that will be separately charged.
Yeah, so this is taking a huge toll on the middle class and upper middle class as well, because most people silence it and mute. Okay, most people would
Sorry, it is
Yeah.
muted.
okay, most people would find it difficult to manage that, no? So Kumar, you have also been talking about pension plan, universal pension plan you mentioned just now. You're talking about, I think it's 500 ringgit a month for everybody. And you're going to submit a memorandum on the 1st to the Prime Minister's office.
Yeah, that's right.
Yeah, could you tell us a bit more about that?
Okay, bearing in mind, like 2/3 of the people who are above 65 years of age will not have enough funds when they reach that age. So to allow them to age with dignity, we have proposed that the government gives them $500 a month, till the end of their lives. So we have costed this. It'll come to about 12 billion a year, because right now we have about maybe 1.8 billion in that category. There are maybe about 2.5 million who are now above 65 years old in this country. And we say 1/3 of them probably will have enough funds to look after themselves. So 2/3 of that's about 1.8 million. And times that by 500 a month, we get about 10.8 billion per year. Fairly big, because if you look at the welfare department budget is about 3 billion a year. This is 10.8, 11 billion. You look at the health ministry budget is about 42 billion a year. And that's the second largest ministry. So this amount of 500 a month will not be enough for the man, and let's say the man and his wife are together only $1,000 a month. It's not enough for them to live on their own. But it'll be a great help to the child who's looking after them to have this extra $500. And it will make them less unwanted. Now the problem is the children will be kind of wondering who can look after the parent, and there'll be some quarrels about that. And people can't, not that our Malaysian families don't like their parents or they don't have any loyalty, but just that we are low wage economy. And these families are also struggling to stay afloat. So it is difficult for them. So this amount is to aid these families, to aid everyone, and allow them to live with some dignity.
Yeah, but how would that compare to like a national insurance scheme, like in the UK, where everybody contributes to a national insurance scheme and then they get a minimum old age pension? I don't know, a couple of £100 a week, no?
Yeah, Anil, if you look at UK, look at all the European countries, they have these insurance schemes. But don't forget, their wages are like 8 to 10 times higher than our wages. The same kind of work, there is something we call wage suppression. It's because of the financial architecture set up during the colonial period, where our raw materials, our labor was all undervalued. So it's wage suppression here. So especially the PSM, we are not really for all this GST and this kind of insurance schemes, because our wages are already low, you see. So, and anyway, how much can they? Right now, already people are paying for the EPF, right? They're paying about 11% for the EPF and another 1% or so for SOCSO, But when you have our median wage now, it's only about 2004, a median wage, 2004 a month. So if we don't solve that problem of low wages, then you cannot actually tax those low wages and say pay some more for insurance and yeah. And if you see SOCSO, EPF is now supposed to collect 11%. So even for those people who are paying EPF, only 20% of them are actually covered, have enough savings to look after them in old age. So the issue is not insurance scheme. The issue is, that's not the solution. The issue is low wages, wage suppression, and that's got to be addressed.
Yeah. So your 500 ringgit a month, the pension that you're proposing, um, you mentioned how many billion is going to cost per year?
11 billion.
Yeah, and could you explain how how you propose for the government to finance it? Because we know that federal government debt is like 1.2, 1.5 trillion ringgit, and
Yeah.
then the argument thrown back at you.
Yeah.
How would you propose to overcome that?
Okay, maybe can I go to maybe slide 7 if I don't mind? I can just yeah, actually our government debt is big. You know, if you look at the actual debt's about more than 1 trillion. So no, there's 1,000 billion. I got to go down number 7, down to slide number 7. And you see, if you look at last year's budget, it was about 390 billion. Okay. And that budget had a deficit of about 90 billion. That means you're only collecting about 300 billion. And we had to kind of borrow 90 billion. And basically we borrow by floating bonds, right? And the total debt is already about 1,000 billion, a trillion. And this debt, every year we borrow, and when the debt, when the bonds become due, we can't pay back because we are still in a deficit. So we've actually been piling on debt for the last 25 years. So like in 2024, we borrowed 90 billion. We kind of borrowed 90 billion new bonds, 90 billion to meet our deficit. And we had another 85 billion that we had to float bonds to pay back the bonds that were maturing in this year, right? The bonds mature and you got to pay them back. And so we're not paying them back from our actual collections, from revenue. We're paying them back by borrowing again, you see. So this current year, you're borrowing a total of about 170, 180 billion. And the debt servicing, the interest you pay on the debt is about 45 billion now. So go to the next one, please, if you don't mind. Next slide, 8. See, this is the reason why we're having a deficit. Our federal government expenditure, our federal government revenue has actually come down from about 30% of GDP. Now it's only about 15% of GDP, our revenue. No? And this is because since the 1990, after the Soviet Union collapse, unipolar world, the financial liberalization and all, it's become very, very easy for corporates to avoid being taxed. And if you tax them too much, they'll run away to a tax haven, they run away to another country. So tax rates have come down all over the world, you see, not only in Malaysia. Malaysia, you're 40% in 1980s, corporate tax on profits. Now it's down to 24%. Singapore is only about 18% of corporate profits. Thailand is about 20% of corporate profits. So we've been playing this game of race to the bottom. You know, we are all reducing our corporate taxes, hopefully trying to keep our investors and trying to entice FDI into our country. But as a result of that, government revenue is not there to look after the essential things like our healthcare system is so grossly underfunded. And we can't do the things we need to do for the environment. Transition to green energy, we can't do. Don't have enough money. And same thing again here about pension. I think it's very, very necessary now. But again, the whole story is it's difficult because see, I agree with the government. It is difficult at this point for just one country to come in and say, I'm going to raise taxes. But this is something that the government has got to talk to other countries in ASEAN and elsewhere. See, you must have heard about the global minimum tax, 15%, right? There's an initiative from the OECD where they brought this idea that you cannot, that a multinational corporation earning more than 750 billion euros a year gross revenue must pay at least 15% tax. And if that fellow doesn't pay it in Malaysia, that tax will be collected when it goes back to the home country. So minimum tax. And that's a good initiative. We're going to work on initiatives like that so that we have sufficient tax collection. Can you imagine? Revenue has gone down as percentage of GDP from 30% down to now 15%. So how can the government meet this? So, and this is something the government has got to look at. instead of looking at how do you squeeze more money out of the underpaid population by GST, we've got to think of how in the longer run we can work with the UN, we can work within ASEAN, and stop this, disastrous, 0%. Right now, you must have seen the papers. They're starting these family offices in Johor, Forest City. They're going to give them 0% tax. We're trying to entice them to come over from Singapore. Singapore also has got a lot of family offices. And of course, Singapore is going to lower tax as well. So this race to the bottom is not going to do any of us any good, you see. So these are the kind of things that our government has got to recognize, first of all, recognize this is a problem. This maldistribution of the income of our society to the richest people, and it's really having problems in terms of us being able to look after the environment and look after the people in need. You see, Anil, our GDP has grown about 25-fold, in real terms. That means taking away the effect of inflation, our GDP has grown 25-fold in the last 50 years. But median wages has only grown 2 times. And government revenue as a percentage of total income has dropped to about half. 30% has come down to 15%. These are the real statistics. This is a real malady, it's a real problem. And not only for us, it's also the same problem that the Western countries face. So you've got to bring it up, because if we don't have enough money coming into governments, then governments are the ones who do the things that are not profitable. Reforesting our forests, or cleaning up our rivers, or starting a proper waste management scheme. These are not profitable activities, and government's got to do it.
Kumar,
Yeah.
related to that, we've talked about the falling taxation revenue. We're already having a tight squeeze on our public healthcare system, and it's only public healthcare spending is probably only about above 2% of GDP.
Yeah.
What percentage do you think it should be? And as it is, many of the older people have problems going to the general hospitals because there are long queues and they have to keep coming back for medicine every month and that kind of thing, no? And you also talked about the specialists being migrating to the private sector. So what can we do with the public healthcare system? And especially now they're talking about private wings. How will that affect older people in the years to come?
Yeah, I think you're right. If you identify healthcare, that's the other major thing for the elderly population. One is some income security. They need to have some income. The other thing is they need to have access to good healthcare. And actually, our healthcare system is still pretty good. It's one of the better features of our society, where it reflects the solidarity that we have among us. That if you are not well, you go to hospital. They don't see whether you're rich or you're poor. You get treated. And I think we have a lot of very dedicated people who are still working there. And they know what to do if they get more money. So I think what we should be pushing for is they should be getting more funds to do the things that I think they know what to do. We don't have to tell them what they need to do. I think they know what to do. Our current healthcare budget is only about 2.2% of GDP. Whereas if you look at, say, UK or look at Japan, they're spending about 9.5, 10% of GDP on healthcare. So we are so grossly down, and we're saying, we want to be, we're going to be an advanced country. We are at the, cusp of becoming advanced, and we're so happy about it. But we're still following third world standards for healthcare. I mean, that doesn't jive, you see. Want to be an advanced country, then you follow them. France, Germany, Britain, all about 9 to 10%. US is even worse. US is about 15%, but they've got a very inefficient healthcare system. But we should push it up. But right now, I mean, what we said earlier, that the government is facing budget deficits, that's true. The government does have a budget deficit. It's a real problem. When you're spending 45 billion a year on debt, on paying back your interest, you're paying more on your interest on our debt than for the health ministry budget, which is 42 or 43 billion. They're paying about 45 billion So it is a problem, but we have to address that problem. If you don't mind, you just go to the last slide I put up, because we gave the Prime Minister a memorandum, giving him a list of things that they should do to raise revenue. And some things are long-term, and some things are short-term. The next one, please. The next one after this. Yeah. So the one thing of increasing taxes on big corporations, I emphasize big, not the SMEs, the big corporations and the P5, the top 5%. This has got to be done in tandem with other countries. If only Malaysia does that, let's say we increase our corporate taxes to 30%, we would have problems with employment, because even our local investors, Malaysians who are investing in Malaysia, would tend to kind of build a new factory in Thailand or in Vietnam, where the tax rates are lower. This has got to be done collectively. So it's going to take some time to negotiate that. But all the other things, like subsidy rationalization, we spend about 60 billion on subsidies. And as the Prime Minister says, a lot of it goes to the richer people, like for example, the subsidy of petrol. It's the richer people who could drive up and down and have bigger cars and all that. So more of it goes to them. So these are the things they got to look into it, how they can reduce the subsidy going to the top 40% and channel that money into programs. And look at corruption and wastages. I think it's about 30 billion a year is lost because of corruption and wastages. And there are ways of looking into this, You've got to see how we can reduce this. I mean, for one example I'll give you. In Malaysia now, it's very difficult to prove corruption. You got to really show on what date, where, how much money was transferred. We could just change our corruption laws to say that anyone, any public official, any politician who has got more money, more wealth than he can explain from his income, from his legal income, is presumed corrupt. Unless he can show he had a rich father or someone who gave him that money, Otherwise, you're corrupt. Show us where you got the money from. I mean, with your pay as an MP or pay as your minister, you couldn't have got all this wealth. So where do you get it from? So I think those kinds of laws are not there. We should bring it in. And there's a thing called debt monetization, it's a modern monetary theory. It does have some problems. You can't overdo it. It can cause inflation. But it can be used judiciously. These are the things that we had a long memorandum that we presented to the Ministry of Health last year saying, look, yeah, you're short of money, but these are the ways you can get money. The short term, you can do 2, 3, 4. And number 5 is what Singapore uses, certificate of entitlement to buy cars. Have something like that for Malaysia as well, especially for the cars more than 2 liters and for the cars that are more expensive. And that money can be used for other things, is it? So there are things that can be done. I mean, there is a problem, but there are things that can be done if the government puts its mind to it.
Yeah, thanks, Kumar. Cecilia, I just want to ask you, in terms of the resources and infrastructure for caring for older people, what do you think the government can provide that will ease problems for older people in Malaysia in the coming years? In terms of infrastructure, resources?
Yeah, I think if you look at, we have actually ample time. We have been talking about this for the past, 10, 20 years, that we are going to reach an aging population, and are we prepared about it? And we have been discussing about it, but I don't see that there's any serious steps taken, policy changes, infrastructures being built, just the whole infra, the whole model, the whole setup of Malaysia is actually built for youth. We are very youth-centric. And when we talk about how are we prepared for an aging population, usually immediately we talk about, is there enough nursing homes? As though that is the only solutions. So I think we have to look more holistically. I was previously working with a developer who was introducing a retirement resort, and that's how I decided to embark on my research. And my research is on older people, and I realized that very, very few elderly, and this is globally, that would plan one day when I grow old, I'm going to stay in a nursing home. That is always the last resort for, I think, all of us, universally. And what we want, mostly what all of us want, is to age in place. That means to age in a place of our choice. It could be our home. It could be that I want to downsize now. I had a bungalow, now I want to stay in an apartment or a single story. But it is my choice as a human being how I want to age, not to be put away in an institution only for the old people, and you isolate me away from the community. So I think looking at that, government need to understand what is the preference of older Malaysians, and that B is to age in place. Mostly is the home of their choice, where they are comfortable, where they have support system. And I think we need to look at infrastructures and models on how do we support people to age in place, so that as we grow older, if we have challenges, it is not because of the aging process, because it's a natural process for people to grow old, but how do we then support them as a community, as a society? When a person ages in his place, how do we develop a system? And I think we have to look at it holistically on how do we go to a mall, for example. I just went to a mall last week in KL. You don't even have sitting chairs for people, for older people. Even when I was walking and was looking for a seat, and if you look for a washroom, you have to really walk miles, to look for a toilet. And things like that, And even when I took my mom to the bank, she has to climb the flight of stairs to do her banking. These are not older friendly at all. So whatever the infrastructure and the facilities that we have are not at all elder friendly. So we really need to think about that and actually plan or whatever that we have, and we plan in future, and what is existing and now must have that in mind. It have to be not just elder friendly in terms of, okay, Penang is going to be an elder friendly because we follow the 5 pillars according to WHO, and we got that, and that's done, and we can put a certificate. But is it really what we are doing for the elderly Malaysians?
I think you mentioned aging in place. I have a friend in Australia who the government, they're independent social workers, and the government pays them to go into the homes of the elderly and help them out whatever they need in their place for that week. And they come in every week, once a week or twice a week, and they just visit the older people, and the government finances that. I'm just wondering whether such a thing would be practical in Malaysia, especially given that there's so many unemployed people and dropouts from school, whether they can be trained in this kind of elder care in Malaysia. Is that something that is feasible in Malaysia?
Interesting. This model is been carried out in our neighboring country, Singapore, for years now. And Singapore have started looking at what kind of models do we support Singaporeans to age in place since the 1980s, and they are revising it every 5 years. And they have a very intricate support system that is community-based. So they do have this whole setup team of social worker, occupational therapists, a whole team, which then they have a hub. Like here, Jelutong, for example, they have a Jelutong community hub where they keep actually data, and the data including the elderly. So if I have diabetes, they will be able to then check, okay, what is Cecilia's sugar level, and whether she, is she having any increased risk? Is the BP increasing? So they have the data of even monitoring. So if at all they can see that, Cecilia is having a higher risk now, she's more frail, then the team would actually go and do preventive measures and not wait until the person collapse, hypoglycemic, and end up in ICU. And then that's where the extra resources are being used. We actually do a lot of preventive And I think Malaysia can definitely do that. We can actually do, I have been talking to the certain people about it. I'm not going to mention names, that we can actually try to do it in a pilot study in a small area, and we can monitor it, and we can assess it, and we can fine tune it, and you know, and see if we can then duplicate it, and without costing so much. We can start on a smaller scale. I think it definitely can be done, and I think that is more suitable, something to be that we would actually help in the long term. And we also have to look actually now, you know, 20 years ago, if we plan this, 20 years later, we will not be in this situation. We are looking at now, look at Malaysia, the obesity rate, we are on one of the highest. Diabetic rate, we are the highest, you know, cardiovascular diseases and all that, sedentary lifestyles. Malaysia is the highest. And young people now, they are the least, they don't exercise, they don't believe in working out and having a healthy lifestyle. So what will happen to them as they grow old? They will have all these issues and health problems that is related to lifestyle, which can be prevented from now. And that is, I think we have to also look at it. And that's what I mean by looking at it holistically. Yes, we have to look at the existing situation, but we also have to plan ahead. And I think we have to look at strategies at how to support people to age in place. And what you say, Anil, you know, having a whole team to monitor and assess and feedback and reassess the situation and see if it's effective, and then fine tune. It could be something that's very useful for us Malaysians.
You have also worked in a daycare center associated with a private hospital for people, drop-in patients with dementia. I'm just wondering to what extent is this able to be replicated in other, not just private hospitals or private daycare centers, but is that something that the local councils, for instance, can replicate in their various areas, and how would they go about it?
Yes, I also have been talking to certain people about it. When for me, what I'm doing, because as my passion is in dementia care, and I feel that there's a lot of stigma, there's a lot of negative elements and stereotypes and abuse when it comes to dementia. And so I'm an active advocate. And in order to show it, to prove it, I have to have a center to show them that I'm not all talk, you know, that I can actually deliver. And, you know, so we do have a little center in Butterworth, but I'm not here to promote it. And I feel that this, it is a daycare, you know, it is a daycare where people come and they are being reintegrated back to the society, to the community. So we want to create an all-inclusive community, not to isolate and segregate. You got dementia, you're cognitively different, so we put you away in the facility, not to be seen. Yeah, they're very different than to us, but aging and dementia and all that do not exist in a vacuum. It exists in a society, and it's all socially constructed. So the amazing thing, if it's socially constructed, then we can do something about it. And it's really up to us. So to answer to your question is, I have actually spoken to certain people that we can actually use the existing infra, that is Poway, Pusat Activity Warga Emas. We have how many? Let me see. We have about 88 Poway in Malaysia. And
Pusat Activity Warga Mas.
Pusat Activity Warga Emas, that belongs to the government under the welfare department, right? And I will be brave enough to say that majority of it are white elephants. They're not being utilized. It's just used for certain majlis, Hari Raya. Again, disclosure, this is me, Hari Raya, and you know. So this Pusat Poway, you know, the Poway can be actually used as a daycare. And we have a lot of senior citizens who are ready to become volunteers. We have students who can come as interns. We have a lot of university students. We have, you know, and these are the resources that we can tap on. And people who are retired teachers and nurses, we can tap them back and come to work as a team to provide care, to support them, you know, to integrate them to create an all-inclusive society that people can come in and mingle and exist and cook and socialize and go back. Caregivers can come and get their support. Family members can come and meet with each other, and they can get counseling, and we can even do trainings there on how to care for their loved ones living with dementia. A lot of things can be done in the hub, so we can actually duplicate them within to start with, the pathways.
One other serious problem I think is that older people face is a sense of isolation, and part of the reason is that maybe our external environment is not disabled friendly. Everything from the tram to the pavements to public transport to it's just difficult for people to get around, and also the buildings, like you mentioned earlier. Is there anything being done to address this kind of mobility problems? Like in the West, you can see a lot of people out, older people out on the streets using public transport, wheelchairs on the pavements, no obstructions. But our pavements are full of obstructions. Yeah.
Yeah, I think the answer is pretty obvious, isn't it?
Yeah,
That,
but is
yeah.
anything being done to?
I know Penang actually, and now they are trying to turn Penang into age-friendly city. And I think they wanted to start it in Taiping, and it didn't work out. So now Penang is taking the head. And we are actually, we are actually looking at infrastructures and whether transportations, there are like 8 pillars that we have to follow to get the title and age-friendly. And I don't know, I seriously have not really seen people coming seriously together from a very diverse group, people from different departments, because it is just not the medical people. It is not just the building people, this is the transportation, it is the physiotherapy, the rehab therapy, the healthcare system, the education system, academia, everybody coming together to discuss how, it's just like Singapore, how can we do this together as a nation to create an age-friendly environment for all? Because there's one thing that we all share is we're all going to age and we're all going to die. That is 100% that's going to happen. But I think because the priority is like very different, it's like Dr. Kumar says, it's not really very attractive. It's not income generating. It's not as sexy as building the MRT and not development, getting foreign investors and having super mega buildings and all that. It's definitely something that it's not, it doesn't make you really popular because you don't really become rich because of that. So I think that is why we are not getting the attention from the government when it comes to taking this actually very seriously.
Okay, thank you, Cecilia. Now I'd like to take questions from the floor. If you, as well as people on Zoom, can put down your questions in the chat. For the questions from the floor, please identify yourself and keep your questions short, please, so that others also can chime in. Anybody? Pass the mic. The mic. Mic.
Hi, my name is Na from USM. Yeah, I believe there's one MP that is very active in advocate for elderly care. To came out with a white papers for elderly care, a comprehensive one. Is it? I'm not sure. Is it MP for Ipoh or what? But I believe I read the white paper that he suggested is very much lean towards provide incentive for the private sectors to produce enough care workers or some kind of subsidy for the private sectors. It seems like he does not want to directly want the government to intervene in producing this comprehensive elderly care, but instead relying on the private sectors. Uh, this question is directed to Dr. Jayakumar. What's your opinion on it? Whether or not these kind of privatizations, private sectors or private sector methods work, or we need direct government intervention instead of these kind of incentive structures intervention. That's all.
Thanks. Kumar, would you like to respond?
Yeah, I think overall private sector initiatives will require money and they do it for profit motive, and so it's the limitations. Now, I think, from what Cecilia was talking about just before this, I think one of the things that everyone needs, including the elderly, is to be part of the community, to feel useful. And I think just because they're above 70 doesn't mean they are, like useless and they have to be looked after, I think they've got a lot they can still contribute to making our neighborhoods communities, in helping the younger generation grow up in a safe environment. And we've got to see how we can set up a society where the wisdom and the skill of the people from, say, about the age of 65 to even 85, 85, 90, they can, some of them, can be quite active to that age. So to look at all of them as a burden that we somehow got to manage is wrong. I think there's so much they can contribute. So if we're talking about whether private sector or government, I'll say, how about the retired people themselves as a source of help to other old people and also to other people, other disabled people in community, other people who are alone. Can they play a role in making our neighborhoods into communities? Activities for younger children and those kinds of things. So it's not just we just feed them and we give them a place to stay and we make sure they can grow up on the pavement and give them healthcare, but should make them an active part of society. I think we can do that. I think we're doing a great deal for them. So it's a different concept, that involve them in their own care. And but generally, if you make it a commercial thing, then it becomes a problem. I think there's a lot of problems with that.
Okay, thanks, Kumar. Any other questions?
Thank you, Mr. Anil. My name is Soma, Mr. Soma from ex-USM staff. I am a bit skeptical. I'm a bit worried about. I don't seem to be very comfortable with whatever with regards to old age and dementia and all that problems. I noticed that in my family itself, at this moment of time, maybe it is because we are all coming to the aging group. Therefore, this is common. About 5 or 6 people are already in dementia, and there's 1 or 2 on Parkinson's and all that. It's pretty shocking to me, this trend. Why is it common that at this moment of time that this increase is taking place? I'm not sure. Maybe Mrs. Cecilia can. When we did some project work in USM on aging, there was a revelation that that was about 7-8 years ago. 12% of population is aging, and everybody was shocked. Including the lecturer was shocked too. So what are we doing? Are we ready, or are our great leaders knowledgeable? The ministry people are knowledgeable. Can they handle it? What are they going to do? I mean, there's no answer at all until now. I think Cecilia has put in some very good projects and remedial situations and all that. But otherwise, what is the government's role as compared to other countries and so on? I'm a bit very, very unhappy about this. Because my family itself, my specialists can tell me, Mr. Soma, you're going to have a tough time. I mean, I don't mind telling you, kamu jadi mangsa, karena you are a carer, So that is it.
Well, what would you like to see the government doing?
I want the government to be knowledgeable how to handle first class, how to handle the whole situation. do they have any programs? Do they have any ideas? Or just moving along as the people are all,
Kumar, would you like to say how respond to this?
I think, aging is one thing, and then illnesses that come, specific illnesses that come is yet another thing that complicates it, So it's two different, it's part of the same problem. And I think we just need to have a good healthcare system. Because right now, our healthcare system actually is very good. Only thing is, because of the private sector, now we have about 75% of our specialists are in the private sector. Specialists with more than 10 years of experience post the specialization, 75% of them are in the private sector. And only 25% are in the government sector, where about 70% of the people go. So we got to look at things like that, make sure that people who need help do get the help, So to increase the number of senior specialists in government sector and to reduce waiting time, these are things that you got to look at. And it all comes down to funding, really. And the healthcare system knows what it needs to do, but it doesn't have the funds.
So Pamela says there's a shortage of functional medicine practitioners who will treat and reversible disease rather than just treating them. Any other?
Hello.
Yep.
It seems as though the problem of delivery is so much related to the question of over-centralization of our system of government. And I think once upon a time, when things were decentralized to local government levels, the municipalities and local governments actually did a better job. And I think if you look at the UK system, it's the boroughs which actually deliver. It's local council, and the whole competition is very much, so you can really ignore actually the very top, but you can focus on actually delivery at the local level. And you don't even need to have a federal system for this purpose, because there's a lot of decentralization that's been taking place in countries like Thailand and Philippines who don't advocate, do not practice a federal system. And yet actually now there's a lot more participation at the local of decision-making at the local level. And this includes then taking care of the needs of the community. They beautify the place, they actually make it touristy, very attractive. And also they can begin to take care of their, their own elderly in a community, in the context of a local community. My recollection, I'm 70 plus now. My recollection is that local governments used to play a more active role. I remember, they had what do you call it? The maternity services at the local level, and they used to come to visit after maternity within a month. The nurse will come and visit you, make sure you don't have jaundice, things like that. But we have gotten rid of this system. My wife, Sui Beng's mother, she was a local municipal council bidan. She delivered thousands of children, and she was then absorbed in the local system. I think that change actually takes place after 69. With the new economic policy, the federal government then begins to tighten, control everything, principally to make sure that the new economic policy is delivered. And they control a bus system, routing, municipal council and everything. And the only way of decentralization today is actually via privatization, which is completely wrong. It's not the same concept. And I, for one, want to go back to decentralization, to enhancing the role, the more funding, more jurisdictions being given to the local council. It does not need to be accompanied by local government elections. which is actually part of the problem in our political system. Because I think all the non-Malays will then begin to control everything and all that. Actually, what I'm talking about is redistribution of responsibilities, of opportunities, of funding to the local levels, which is actually the level of government which is the closest to people. And the logic is that when you begin to do that, local government knows your problems better than Putrajaya or Naypyidaw or New Delhi or Washington. It's local government that knows your needs for aging, dementia, a lack of gerontologists or doctors specializing in this very unlucrative area of medicine, and so on and so forth. That's all I want to say.
Okay, thank you. Yeah, I think that's an important point, decentralization. A lot of the things, like for example, hiring social workers also can be done by local councils, operating daycare centers as well, no? Even homes for the elderly or low income group, they can also be managed by local councils, I think. Anybody else? Yeah.
Yeah, Anil,
The mic.
Anil, can I say something about this local council?
Kumar?
Yeah, I think decentralization is good, but there must be democracy going along with it. I mean, I can imagine local fiefdoms, local elites taking control of the process and also misusing the system. Just decentralization by itself, without a proper democratic system, you can have problems. You can have in some places, not all places, maybe in some places you have some families, the more elite families, is controlling the whole process, controlling what's being done, what's being decided. And if you look at America, the school system is decentralized. So and even the collection of funds is the other thing. If you got to collect funds and run your schools, then the poorer districts have poorer schools. So you got to see how funds are per capita population. Whatever services they're providing, they can't be asked to collect the funds themselves. It's got to be centrally collected, and so it can be distributed equally by a per capita basis. Otherwise, like I say in the US, certain districts, certain states have got very poor education. So I think there are pros and cons, you see. I mean, yes, decentralized, but you got to look into all these things. Democracy, source of funds, or it can be a mess as well.
Yeah, I think this is the distribution of power between the different levels of government. And actually, the task can be done at this level. But the role of federal government is very often now to redistribute. Find the lag and you then channel funds that you have collected from the general population to actually, fulfill the needs of the local community. And this happens, progressively throughout. And it is decentralizing, letting it go. Doesn't mean that, if you are allocated the particular jurisdiction, you have to pay for it all by yourself. The role, and in India, for instance, the milk drinking scheme, which is a nationally funded program, is actually financed by the federal government for all the states. And the federal government also begins, to look at, say, the state of Bihar, Andhra Pradesh, and these places like that, that actually do not have enough money. Their schools are very poor. A lot of children cannot go to school. So they actually then make sure that the federal government, they build ashrams, and then to make sure that Harijan children and all that then can go and stay in these places, and then they can access school systems. So there is, but I think there's a way to decentralize and to redistribute the different kinds of roles that different levels of government play. And I think this can be actually very liberating, very democratic, even without the electoral process, because you encourage participation. And evidence has been shown very clearly that women, best of all, can play an important role actually at the local level. because they can do it in between, minding the house, taking care of the children, going to the fields, and yet they can actually then attend local council meetings.
Okay, please introduce yourself.
My name is Santok. Actually, I'm from the Age Corp. Penang. Age Corp is the Association for Private Care Centers. So I'm also the National Vice President for Age Corp. I just would like to share some things like that. It's happening from my view as Age Cap operators. First of all, whether the question of whether the government is ready to face the challenges of aging population. I will say, like Cecilia will agree with me because we had been working together. So we had been championing this issue since 2017, engaging with the government and trying to tell them that we have to be prepared because Penang is the second highest aging population after Perak. So we had been engaging not only local but also at the federal level and trying to propose some things, that how we can tackle this issue. But until today, even yesterday, we had a press statement also of issue from JKM and also local ADUN. But the thing is that the government, I don't know, for some reason, they are not willing to, accept our ideas and then implementing it, Rather than that, what they are trying to do is that they engage consultants from various universities and private sectors to get their ideas how to overcome this issue. We, the operators, private care operators, we are on the ground. We know what is happening, what is the actual issues. But I don't know, for some reason, they are not listening to us. So that is one thing. So the government basically is, they have to sit down, not only to listen to us, but also those who are into this line and find a solution fast. Because there's a lot of problems outside there, especially for senior citizens. So I would like to share what happened yesterday. A few days back, one of the care home in Lumbakuda, the JKM came and harassed that lady to close down. She is more to charitable organization. She collects people from the street and she's looking after them. So in this incident, what happened is that one of the neighbor complained to one of the ADUN locally. That ADUN went and complained to the JKM and said, please close down this. The ADUN is more interested in his voters rather than the senior citizens. So he asked to close down and the JKM came and scolded that lady and asked to close down. So when the lady did not close down, because she is telling what, okay, I don't mind closing. The government should jump in and find space for these people. Where are these people going to go? They're going to go to the roads again. So when the lady did not listen, what happened is that the JKM quickly cut down their allowances, the senior citizen allowances. They were getting, I think, about 500 ringgit each of them, the senior citizen. She used to take that particular money and she ran the home for the rental, food, and so on. Suddenly they cut down, this month, they cut down that allowance, So now we are looking at JKM. You are the guys supposed to look after the senior citizen, and you go to the extent being like inhuman by cutting down that allowances, senior citizen allowance. Now what is going to happen to these people?
How do you think, what do you think of that? The local government, I think the state government set up a transit home for elderly people near Komta.
No, the transit is same thing. The transit, what they call home or center is another, I would say, white elephant. No, it is just a transit. That means you can't really, stay for longer term, So somehow also these people will still go back to the roadside, Like what this lady is doing is that JKM and also the welfare department from the hospital, they will send these people there. Because why? Some of the family members, they just dump them in the hospital, these senior citizens. There are some members there are abandoned by their family members. So there's nowhere to go. So this lady collects them and then she looks after them. This is what she is doing. But this should be done by the Kebajikan. So this is one thing which we were not happy on. How come JKM can do to the extent cutting down their allowance and then just put them, in trouble.
So why did the neighbor complain? I mean, what was the problem?
Which one?
You said the neighbor complained to.
No, this is everywhere. That is another issue that we are facing, all the care centers, Our citizens, especially Malaysians, they are not ready mentally to accept these senior citizens in the system, okay? We got situations where people open childcare centers, kindergartens next door, no issue. But when it comes to old senior citizens opening up next door, there's an issue. They say there's a noise, smell, and this and that, But what we feel is that we are into aging population. So when we are into aging population, public themselves also must change their mindset, willing to accept them. Like, dementia cases we got, they are into depression, so much of issues among themselves. So public themselves also, they can't accept. The moment you open a care center next somebody's house, immediately they will go and complain. This is also a problem that we are facing. Apart from that, we are also facing problem of helpers, caregivers. Our local, especially youngsters, they are not interested to work in the care centers because this job is not an easy job. It's also, like dirty and it's a boring job, Nowadays, youngsters, whether they are from the nursing college or even from, highly educated, they are not interested in this job because there's no progress in this career-wise, there's no progress, So workers is another big problem. Last time there were, people were interested to go to these kind of centers, to help. Now we don't get that also. People are not coming forward. They are all to themselves, So we also put in the proposal to the Human Resources Minister to bring in foreign workers because they can work. Many of the centers we have foreign workers. Only they can do this kind of work. But the other problem that we are facing from the government is that the policies, the guidelines, the act related to these care centers is obsolete. I don't know when they did this kind of, act and guidelines. So now the care centers are having problem to even get a license, In Penang, we got roughly about 120 care centers. Out of that, most probably about 10 only are licensed, The rest are all not licensed. Why? It's because of the guidelines, the act, and the policies that is in place now. It's obsolete. The government should make it a bit relaxed so that those care centers, they can apply easily so that we can provide that service, needed by the older generation.
Okay, thank you.
All right.
Thanks. Yeah. Evening.
Just want to respond to you. What's your name again? Samto. I used to work as an ambulance crew in St. John Ambulance full time for 2.5 years, right? So I frequently visit all these elderly homes, licensed and both licensed and unlicensed. And I'm not sure when you said we want to relax the guideline, the policies, could you be more specific? Because with current guideline, if even they are adhere, I don't think they are good, at least on the standard. For examples, when you see because from my perspective as an ambulance crew, right? So a lot of times when we arrive, the person is not breathing properly. The home care workers should at least do some CPR, that kind of basic stuff, right? Or we also face a lot of cases whereby because after they discharge, the elderly discharged from the hospital, right? And we send the elderly back to the private home care. And after maybe 1 week, 2 weeks, the elderly will most probably go back to hospital because of some kind of infection because the private home care workers there do not have basic skills to care about the wounds. After they injured their backs or they lie at the bed for too long, there's bed sore and that kind of stuff, right? So when you suggest we need to import all the foreign workers, there's also the communication issue, right? Even you train them in the local language, how much they actually know about the language to communicate effectively with the elderlies. And that's my concern with all your suggestions. Maybe you can give some specific example how exactly you can relax the guideline in order for the license to be given to all those private home cares.
Okay, thanks for the question. Okay, you see this, our Age Corp Association, we don't, I mean, our job basically is what, is that we look after each other, all the centers, we look after each other. Apart from that, there's one more portion is that we have started now caregivers training. There are certain centers in KL and also in Ipoh. What we do is that we send our workers there, batch by batch, and they are trained on the basic, what they call the caregiving thing, caregiving process. Whereas the other thing is that each home, they will have their own nurses. These are qualified nurses from private hospitals and also from GH who are working with us like part-time. So they are well versed with this CPR thing and other signs. Like, if they find that the patient is not doing well, they will immediately inform our manager of the care center. Then quickly we will send them out to GH. Why we don't treat them in the place is that because why no? Our centers are B40 centers. That means we cater only for B40, and we are not nursing home where they come with the rice tube and oxygen and so on. So we don't take that kind of patient because why? To handle those kind of patients, you need to have a doctor at site. We don't have that. So since we are B40, we are catering for B40, what they call public. So we have qualified nurses. Only thing is that our policy is that the moment we feel that the person is not doing well, we immediately send hospital.
Okay, right. Thanks. Cecilia, what's your impression of you worked in a care home for a long time before. What's your impression of the state of our care homes?
I am in a very weird position. Yeah, I'm in this industry for the past 20 years. And I said that it's kind of weird, when I remember the first experience I have stepping into a facility for the elders was when I was 18 years old, and I started, no, actually 16 in the church when our church member used to go to the Sisters of the Poor, and I used to follow them to help out and all that. And then when I went to Singapore and came back, and I saw the first private run nursing home in Kota Permai, BM, where my auntie was staying, I actually had a culture shock, and I was really shocked because it was really sad. It really broke my heart, And that was very long ago. Of course, I was only 18 then. I remember it was in a shop lot. And beside the shop lots, and I think that that particular home is still existing now. Next to it was a industrial tire shop. And upstairs was, there are 3 stories, and then upstairs was catered for those with mental health problem. And that really shocked my whole system, and I was afraid of even returning to Malaysia because I was in Singapore and then in Australia then. Fast forward to now, I think that we do, the situation has improved, but then there is a very varied kind of standards, we have really the upmarket now. And I think we know of them. I'm not really mentioning names, really the upmarket, but for those who can afford, it's got very deep pockets and a lot of dough that can afford and really find establishment to really people, centers who providing for those who maybe can afford not so much. Yeah. And the standards of care, and I'm not blaming anything. That's why I think we have to look at the holistic problem and not pointing fingers at, okay, is it the government's fault or is it the operator's fault and all that? But let's look at the whole picture. How do you then expect if you have a nursing home on operator, if I have 50 residents and I have maybe 5-10 workers to cater for 50 people, and I have to bathe them, change them, feed them, make sure they don't have bed sores, make sure they don't have any infectious diseases and all that. So that is the reality. Yeah, but then we are looking at even when we have foreign workers. At one time, we were allowed to have foreign workers. Even when we had foreign workers at that time, the issue was having the act now that we have is now the Care Act, and now we are trying to step into PAFA's Act 803. There's a transition from this to a more refined act, and that is not reinforced yet. Until today, they have passed in the parliament, but it's not been reinforced. We have no idea what it consists of until today. So things like even though you even though you have domestic helpers and all that, we have cases where how do we ensure that standard of care? Whether you are running an upmarket scale, whether you are charging people 20K a month, or whether you are trying to cater for the P40, how do you manage to provide minimum standard of care that ensure of human dignity, the quality of care, to look at the person, to make sure that it is respected. Many times I know that because of the challenges of the operator face due to shortage of staff and all that, a lot of abuse goes on within the healthcare settings, especially when it comes to dementia, not because they are bad people, but because they do not know how to support a resident who is having some issues because of brain changes like dementia. And if they have exhibit certain issues and characters and behaviors, you do not know how to deal with them, and you have 40 other residents to take care. How then do you deal with it? So you abuse them, or you restrain them, or you restrain them chemically. And I think we've seen a lot of cases. Recently, there was a case in Kulim. Okay, and there was abuse case that went viral, and the caretaker actually took a stick and was beating him down. And that happened recently, about 2 months ago. And what we did was we closed them down, we fined them 5,000, and then we forgot all about it. But this is happening rampantly. And I think we need to understand why is it happening instead of blaming people about it, to understand the reason why it's happening. And I think that we really have to look at providing solutions on how, if a caretaker is unable to then cope, if a person has got dementia, for example, most of the 50% of the cases are in the residential area have got a form of dementia. So then if a caretaker is not able to then respond, it is because they have the lack of skills. And so what we need to provide is provide them with skills, provide them with a hotline. If I do not know how to handle my residents who is shouting away, who wants to go home, who refuse to take medicine, or refuse to bathe, what shall I do? And that should be a hotline where we can then support them by educating them, giving them alternatives, giving them solutions, rather than penalizing them, either removing their license or asking them to stop operation. And what about all these residents? Where are they going to go? Like Santok said. So I think we need to look at things from a wider perspective, from a more holistic perspective. It's
thanks.
bigger than that.
Thanks.
Sorry, a bit long-winded.
Thanks, Cecilia. So we got a comment from Facebook, Miranda Yo. Yes, the local council used to do a great job and life was simple and happier then. Thanks to all of you. Um, finally, I think we nearly reached 4 o'clock already. So we let Kumar have the last word and say you talked about the old age pension scheme for universal pension scheme as well as more funding for general hospitals. What else do you think the government can do as a priority right now? And yeah, can you let us know?
I think this the discussion just now about the standards, I think it's quite a valid thing. You see, everywhere, whenever we put up standards in Parliament, we go and look at the West, we look at New Zealand, we look at Australia, we look at Europe, and we come back with their ideas. And the people writing up these standards are not people in the field, you know. And they put a lot of things that should be there. And if the state gives money, let's say the state gives half the money to these private homes and say, look, we subsidize, then you follow these standards. That's okay, but you expect the homes to collect from the families, and many families can't afford, you know, even $2,000 a month, you know, they all the different children got to get together and they put it together. It's still quite a large sum of money for them, you see. So there is, in a way, not realistic. Some of the legislation we've got regarding the care homes, regarding even preschool training, kindergartens and all that, it's very good, aspirational, but you don't put money into it and expect the operator to collect from the population. You're not being realistic. And because of that, when you have only, let's say, you know, Cecilia was saying only like 10 homes, or Santok was saying, of the 120 homes, care centers in Penang, only 20 are registered. And then it misses the point. If you don't register them, then you don't have a proper, you know, oversight. So I think there's a bit of unrealistic thing there, you know. You can't register them properly and you can't have oversight. Coming back, this is my last point would be that the whole topic is, are we prepared for an aging population? I think right now we don't seem to be very well prepared, because what the main things are, I think, is financial insecurity. That's one main thing, and the other one is access to good healthcare. And for both of these, we know what needs to be done, but the problem the government is facing is budgetary, and because of that, what needs to be done is being postponed. So I think this is a basic problem. I think the people in charge know what needs to be done, but without handling the issue of how is societal wealth being distributed, without handling that issue, which is both political and economic, a lot of things that need to be done in our society cannot be done. And so right now we're not prepared. And there's elderly poverty is already a reality. It's going to get worse. And a lot of old people who don't have the economic means often feel they'll be better off dead. Really, you know, it's old age, living long becomes not a blessing, but a curse, you know, if we can't live with dignity. And I think we are in that situation now, because a lot of old people are very bitter because, you know, they don't have the money, and then the children are, you know, having trouble, and then certain words are spoken, it hits them very deeply. So it's not a very good situation. We're not prepared, we're not doing enough. And even now, I don't see the direction in our government addressing the fundamental issue. The fundamental issue is our economy has grown 25-fold in wealth. Yet that wealth is not available to us to look after our old age people or our environment. That is an issue. We need to focus on it and see how they can be better. Thanks, Anil.
Okay, thank you. So thank you everybody for joining us this afternoon, and we hope to see you all again soon. And we'll be announcing webinar talks in the future. Thanks.